We are so happy to have you join us today for this presentation, which will be packed with valuable information. We ask that you please stay muted until the end of the presentation where you will have the opportunity to ask questions and connect with our presenters. Also, we ask that you turn off your camera so that we may have the best quality presentation. If you have questions throughout the presentation, go ahead and enter them in the chat and we will answer during our Q&A. With that said, we'll go ahead and begin with our WOW lead admissions counselor, Joy Vickers, who will be going over the WOW program benefits, eligibility, and requirements. Joy, welcome. Thank you for being here.
Yes, thank you for having me, and I'm just so happy to collaborate with everyone. So as she said, my name is Joy Vickers. I am the lead admission counselor for Warriors on the Way, which we often refer to as WOW. And so I'll be covering just some brief information about what is the WOW program, what's some benefits and eligibility. I know that everyone here is interested in health science or the healthcare industry. And so I want to make sure that everyone is aware of this transfer pathways program that we offer, in which we offer support for students. So just to kind of get started, what is the WOW program? Well, the Words on the Way program offers support services to kind of create a clear pathways and a smooth transition for students that are at San Joaquin Delta College that interested in transferring to Stanislaus State. I'm currently actually at Delta College right now at the Delta Connect Center. I'm here starting in July. I'll be here 4 days a week, Monday through Thursday, so students can meet with me in person, virtually, through Zoom, or on the phone. One of the reasons why we created the Words on the Way program with Delta College is to develop a sense of belonging and a Words community for students, but we're also trying to increase access to higher education, public education to be exact. We want to make sure that students, as one of the only CSUs in the area, that students just have access and a community. Who is the program for? So we're for San Joaquin Delta College, and while we do primarily want to assist students interested in transferring to the Stockton campus, if you are a student that's interested in Turlock, you can still participate in Warriors on the Way, but the focus and the development of the partnership first began to actually help students who wanted to transfer to the Stockton campus, because most students do want to stay local and they don't want to commute. And so just to kind of give you an overview of what some of those programs are that we offer, this is a list of the WOW programs. And you will see on this list towards the bottom is our health science program. So those students who are majoring or obtaining an associate's of science in health science are eligible to join the Warriors on the Way program and then transfer after you apply and you're admitted to the program and earn your bachelor's in health science at Stanislaus State. So there are some benefits to the program. So but before we get into that, the associate's degree at Delta was a 2-year program. We do want to assist students. So if you're a freshman, your first semester, second semester, regardless of where you are, but ideally we do want to touch bases with you as soon as possible to help guide you. But the idea would be that you will complete 60 to 70 transferable units, your lower division graduation requirements. So that's going to be kind of like your US history and your political science, American government courses, also your general education courses, the GE classes that you have to take. It'll be either the associate's degree for transfer courses, or in this case for health science students, be your associate of science courses and the major preparation courses, which you'll hear more about as it relates to health science later on in the information session. After transferring, students complete an additional 50 to 60 units, some upper division, GE classes, major courses, and then depending on the major that students are in, there might be some electives that they need to do. But this is kind of an image in which I like to share with students is that you're completing your first half of your bachelor's degree at Delta College, and then you're going to complete the second half of your bachelor's degree at Stanislaus State. And that's really what the Words on the Way program is designed for. We want to make sure that students are staying on track, that you're taking the classes that you need, that you're not taking any extra classes. Now, if students want to earn additional certifications in other areas, that's fine. But for the Words on the Way, we really are working with you within the associate's degree that is going to transfer into the bachelor's degree. And students, I will add that are in the program have me as their dedicated admissions counselor. They'll also have a transfer advisor at Stan State. And then we also have peer mentors that are transfer students that work with students, because we understand the transfer process can be very stressful and students still need support. And so we really want to work with students, not just when they're at Delta College, but through the admissions process and even once they're at Stan State. We help you just better understand the transfer process and the requirements. I really am hands-on, so I'm here at Delta and students can contact me anytime. You never are going to bug me too much if you have questions, but also those who are in the WOW program do participate in events and activities hosted by WOW. This information session is kind of an example in which we collaborate with staff at Delta College, as well as the faculty and programs at Stanislaus State. And then one benefit is we will waive the $70 application fee for students that plan on transferring to the Stockton campus. If you are in the WOW program, we'll provide you with a coupon code to waive that application. Some examples of workshops that we'll provide for students that are in the Words on the Way program is Cal State Apply, What's Next for Transfer. We'll do some financial aid workshops. Students that are Delta College students are invited to participate into our Dr. Marvin Lou Hughes Leadership Conference. You don't have to actually be a part of WOW to participate in that or some of these workshops, but these are just ideas of things that we will do for students and make sure that we send out announcements and information to invite you to these events. Some ways in which students can join the actual program. First step is to actually be on either the associate's degree for transfer track, or in this case, be on the AS in health science track. And you can meet with your Delta College counselor to confirm if you are already on that track or if that's the right track for you. And then you can go to our website to actually sign up for the program and schedule a meeting with me. You can actually schedule a meeting with me first if you're not sure. And I would like to say why I am here sharing information about the Words on the Way program. You do not need to join Words on the Way in order to be admitted to the health science program. But if you are here at Delta College and you still have a year or two, if you have like a few more semesters, I do encourage you to join the program and get the benefits of having that support system until you are ready to transfer. If you are already towards the end, where you know you're ready to transfer like next semester, you don't have to join this program. So I just want to make sure that's clear about the Words on the Way program. It is an optional program. If you do join, we do just ask that you meet with me regularly, that you're on the right degree track, and then that you participate and be responsive to like the emails and the phone calls, and then that you are continuously enrolled at Delta College and then meet all of the deadlines. So you will, the program will help you stay on track and it will help you meet the requirements for admissions. It still is up to you to actually apply on time and meet all of the deadlines. If you do have any questions, you can reach out to me and also visit the Career and Transfer Center. I'm located on the first floor of the Dorico building in room 132. Okay, so that kind of concludes my section of the presentation. So I'll kind of hand it off back to Makaria to kind of move forward.
Thanks, Joy. Thanks for that presentation. Definitely a lot of perks with the WELL program. And can you repeat again which day students can contact you at the Delta Career Transfer Center?
Yes, I'll actually be here Monday through Thursday, starting in July. So I'll be here 4 days a week. Right now, summer hours, I get off at 4 normally, but I would say during the fall semester, my hours would be from 8 to 5 p.m. With the exception of lunch around noon. So
okay, great. And obviously students can also contact you virtually, and I have put Joy's information in the chat. If you'd like to copy down her information, that would be great. I encourage you to contact her for more information regarding the Warriors on Their Way Health and Science program. Next, we have Dr. Michelle Perea, which is the Health Science Program Director. She will be sharing about the Bachelor's in Health Science program, career paths, salaries, and so much more. Dr. Perea, the floor is yours. Thank you for being here. Dr. Perea, I think you might be muted.
Am I unmuted now? Is my PowerPoint visible?
Yes, you could see it.
Okay.
See it. Yeah, thank you.
Okay. So the health science program here at Stan State is the only non-nursing degree we have in the School of Nursing. So this is a program within the School of Nursing, and we actually created this program because we saw that there were students who were interested in health, but were not being able to get into our nursing program. And so that's one of the reasons why we created this program. And so with this, I just want to give you some information about the health science program. Sorry, that one. It's a degree completion program. So kind of as Joy was saying, it is to complete. So you want those 60 units or 70 units initially, and then have all your GEs, and we'll be talking about that more. And then we're going to complete your bachelor's degree here at Stan State. And it gives students a broad-based health curriculum to succeed in many health-related careers and advance their communities globally. And so the concentration we have at this point in time, we are working on a couple of other concentrations, but right now it's health leadership and administration. And the reason that we decided on this initial concentration is because we actually spoke with many of our institutions, our health institutions here in the Valley, and they were saying that this is an area that they needed more support with. Also, we found that students understanding some of the background information of health, if they decide to go into a bedside career, was very helpful, because a lot of times when students who decide on careers that are at the bedside, that we call, a lot of times they don't understand, you know, the insurance parts of it or other financial parts of it. And so understanding that is a huge undertaking and helps in their field that they go into. And then many of our students also use this degree to springboard into graduate work in public health careers or in other professional health degrees, such as some still go into nursing, others become physician assistants, social workers, or health administrators. So those are all areas that we see students go into, and I'll talk about those a little bit more. So this is a 54-unit accelerated program that is completed in 18 months. And what you take is 2 courses per session. And so there is no summertime off or anything like that. You take 18 months persistently, and you take 2 courses at a time. And so, and they're in 6 to 8 week sessions that you're taking. And a lot of students at first think, oh my gosh, that's so quick. But I'll tell you, by the end, when students have to take a semester course, they're like, that course took forever. They start looking into how to do it and how to work through that. And the courses are, you get 1 course each evening per week, and that's why there's 2 evening courses per week. And the courses are going to be sometime between 5 and 10 p.m. So we do not have any daytime courses. They're all in the evening. And the reason we did this is because we want to support students who do have to work during the day, because we know students that don't have to work during the day can still take also classes in the evening. And this way it supports a bigger population. The courses are hybrid and online. And so we have, there's no courses that are straight in person. They're either going to have some in-person component and some online component. And then we have a few classes that are completely online. And we have 2 cohorts basically starting each year. We have in the spring semester, we have our Stockton cohort, and every fall we have a cohort that starts on the Turlock campus. Our 10th cohort will start on January 2023. So we have been here since 2014. The program is going strong. We have lots of students out there. In fact, I got an email from a student who just got into a master's entry program at UC Davis who sent me an email today. So that was always good news. And one of the best things, I think, because we make sure you get the right advising from the beginning. We provide so much support, is we really have a small attrition rate. So that means that most students who start the program, finish the program, and get their degree. Typically, if we have students stop out, it's typically because they have been accepted to some other health program. Like I have 2 students stopping out of cohort B at this point in time. One got into a nursing program and the other one got into a respiratory therapy program that they had been wanting to go into. So that's typically, so as far as students failing out, if you put in your time and do your work, I mean, like I said, we're very supportive. And so we try to work with you as much as possible. And if you need to retake courses, we talk about how that looks so that you can be successful, because we really want you to be successful. At the same time, none of these courses are watered down, because that's a question that students sometimes will ask me. You have the same faculty teaching these courses that also teach stateside for a lot of these programs. And so these are not watered down courses. You are going to have to study, and your degree from Stan State is just as important as any other degree on campus. So a lot of students also ask me, what do students do with their degree afterwards? So 86% of students were employed immediately or up to 5 months after graduation. And the types of opportunities that they took were an account representative, a patient representative, clinical and administrative assistants, quality improvement project managers, behavioral interventionists, patient financial services, health information, health educators, and then many different positions within the public health department is where we tend to see our students go. So this is with no extra schooling. This is once you graduate with your degree. And then about 51% of our students do go back and further their education. What we've seen students go into different programs are a master's of social work, a master's in health care administration, a master's in public administration, nursing programs. We've seen students go back to physician assistant and then radiology programs. So that's typically where students are going, as well as other public health degrees. So as far as healthcare is a great career to go into. Employment in healthcare occupations is projected to grow 16% from 2020 to 2030, and that's much faster than the average for all occupations, adding about 2.6 million new jobs. Healthcare occupations are projected to add more jobs than any other occupational group. So if you're interested in healthcare, definitely a great field to go into. And so this projected growth is mainly due to aging population, which is leading to more healthcare services. But there's a need for all kinds of different healthcare positions versus only nursing and physicians, what most people understand and know about. So it's important to really think about other career options that are out there. So as far as getting in to the health science program, one, you need to meet the university requirements, and the university requirements that you have to meet to be a transfer student, some of those Joy went over, is you need to have a grade point average of 2.0 or better. You need to have completed at least 60 transferable semester units, and you need to complete at least the golden 4 that they speak about, which is speech, communication, for English comp, critical thinking, and math. And you need to have a grade C or better in all of those courses in order to transfer to any CSU. Now, specifically to health science, so these are the prerequisites to get into our program. You're going to need chemistry, and it's usually a Gen Chem or chemistry for nursing or that type of course. And if you have any questions about if the course you took is supportive of that, you can always reach out to me. You need a physiology course and an anatomy course, or there at Delta, you actually have a combo course of anatomy and physiology that is 5 units or greater. And so we will take that combo instead of taking each independently. The one thing I tell people who decide to do that is if you're thinking about going to graduate school or going to some other professional degree, most of them want anatomy and physiology separately. So you may still have to take those if you decide to go higher in your education. So you don't need that for our program. But I always say, be thinking of what your end goal is and when you make these types of decisions about which course you take. And then we have the Introduction to Health Science course. There isn't one articulated course that is specific, that articulates specifically to the Health Science 1000 or the Introduction to Health Science course. And this course we built was because of what we were seeing with our health science students. And so this course has medical terminology in it. It also has how to support your learning better. And then it has a large half of the course is about different health careers and helping students see other health careers that are available and what the requirements are for that. And so what we've looked at that we will allow to be to fulfill or satisfy this requirement at Delta is that you can take Health Science 36. I'm sorry, I don't know if I think it's Health Science 36. I just put the apostrophe HS 36 and HS 39. So that combination will satisfy it, or the combination of HS 36 and HS 95, or a combination of HS 36 guidance or counseling 31 and FCS 2. So any of those, A, B, or C, any combination of those courses that are there will satisfy the Introduction to Health Science course, because I'm really about getting students in, and but at the same time we want to make sure that they have the foundational knowledge that the course provides. And then the next requirement is human development over the lifespan or an intro to psychology class. So either one is fine. And then lastly is an introduction to sociology class. And it's an introduction to sociology class. It's not any other type of sociology course. So we really want you to have those foundational courses. Now, because this is a 54-unit program, you really need a minimum of 66 lower division transferable units so that you don't have to take any extra courses while you're in the program. Otherwise, which we will advise you at the very beginning if it looks like you're not, because you need at least 120 units to graduate from the university. Okay, and so once all those prereqs are required and all the university requirements are completed, then it's time to apply. And so our application period for the fall for the Turlock cohort is October 15th to May 15th. And then for the spring Stockton cohort, it's August 1st through October 1st. The application may end early if we reach capacity sooner. So we take 30 students in each cohort. So we tell students it is on a first come, first serve basis. So we, as long as you meet all the minimum requirements that I just put up there, then you're accepted into, and we ask you then to apply to the university. So it's a two-step process where first you'll send me your application, your pre-admission form, and then you'll apply to the university. And that's so that I can make sure that you have all the requirements for the program first before you apply to the university. So that's where we start with that. And I'll go through the application process a little bit more in a minute. So there are some courses that you could take prior to entering the program that are in the program, and that's Intro to Computer Information Systems or the Principle of Microeconomics. But I want everybody to remember that they need to take at least 50 units of university level work for graduation. So that's a university requirement, not a health science requirement. So therefore, it's recommended that students that are transferring in take either the Intro to Computer Information Systems or the Principle of, that should say micro, not macro. So I have to change that. Principles of Microeconomics, not both. And that's because, as I said, this program is 54 units. So by taking one of those courses, it takes the program down to 51 units, and you need a minimum of 50 units at the university level. Now, if a student took both of those, then we usually have a talk whether they want to take one of those courses again here at the university, or they can take another course here at the university that they prefer. But just to make it easier on you, I always say take one or the other, not both courses if you want to. It doesn't help you get through the program faster if you haven't taken any of these, or if you did take one of them, it just decreases the cost of the program. Okay, and so another thing that was asked for me is that a lot of times, you know, there are lots of pre-nursing students or students that are interested in nursing. And so there are multiple nursing pathways. So this isn't a one size kind of fits all. So if you're interested in nursing, because I am within the School of Faculty within the School of Nursing, besides the Health Science Program Director, there's different ways. Like if you're like set, like nursing is where I want to go, but I can't seem to get into the program. Right? What else can I do? So right now, without any kind of degree, you have these three options. You can go to a LVN school, a licensed vocational school. And then you can transition into an ADN program, or an associate's degree nursing program is what an ADN is. And so a lot of times the ADN programs have something that if you're an LVN, you can come in, you don't have to take all the courses. In fact, at Stanislaus State, we actually have an LVN to BSN, but we only accept about a couple of students. And that's because it's on a, only if there's openings available can we take students. So we don't have a strict program that way. And then you have the ADN programs at the community colleges, and then you can get your bachelor's degree through transitional programs. And actually we have great collaboration with Delta, MJC, and Merced, where students can start taking the baccalaureate, some of the baccalaureate level courses while they're in their associate degree programs, to make them graduate with their BSN faster once they have their ADN. And then we have the pre-licensure programs here at Stanislaus State. So you can apply to the pre-licensure. So all these first three you do before you have a degree per se. you can apply to all of them to get the nursing degree. Once you have a bachelor's degree, there's actually 2 more pathways that get opened for you. And so the other 2 pathways that get opened for you is an accelerated second degree bachelor's of nursing program. And we have that on the Stockton campus. And so once you have a bachelor's degree, and you could have that bachelor's degree in any, but we have some that we recommend only because they help support your nursing degree more, and it's not so foreign, so if you take something that's very foreign, away from nursing, then it's a little bit harder. You have to wrap your head around these other ones. And then you might have to take the prereqs for the nursing program, where a lot of the programs that we support have similar prereqs. So like the health science program has many of the similar prereqs that nursing does. Also exercise science does, also health promotion does, and then biology also with their pre-health. So those are other degrees on our campus that students can get bachelor's degree that have a lot of the same prereqs. Other ones that I think are really good, and only, is talking to nurses that are very foundational. Like I minored in child development because I knew I wanted to be a pediatric nurse. And so that was a good fit for me to understand children and then later go into nursing as a pediatric nurse. But also sociology and psychology are great ones too. When I teach master's level nurses and they have those backgrounds, just the breadth that they're able to bring in with them and into our profession is just amazing. And so, those are other things to also think about there. And then you can do the accelerated second degree bachelor's, or you can do a master's entry program. So there are some master entry. UOP actually just started one there in Stockton. And then UC Davis has one nearby also. And like I said, one of my previous students from Health Science just got into the one at UC Davis. And so she was so excited to share that information with me today. So those are 2 other pathways that get open to you. It doesn't mean that. Also, I tell students that if nursing is what you really want to do, even after you get your bachelor's degree, you can still also apply to the regular pre-licensure program, and you still can apply to community colleges. In fact, some of my students have gotten their gone back and gotten their RN at the community college after they've graduated with a bachelor's. And I tell them it's not going backwards, because like our master's program in nursing, we actually have what's called a bridge program. So if you have your associate's degree in nursing from a community college, a bachelor's degree and a different degree, and then you want to go to our master's program, you take 4 courses, and that bridges you into our master's program without having to get the bachelor's in nursing degree. And so that way you're able to do that. So you don't have to go back and get a degree if what you really want is a master's in the end. And then if you really want a master's in the end, the master's entry programs are great programs also. So those are just ways, if you're interested in nursing to go into. And then I just wanted to share our site with you for the health science program. So let me just get there. I have too many things open at this point in time that it makes it difficult for me to find what I want. Okay, hold on just a minute. I think I'm ready now. Okay, so I believe I'm sharing the program overview of, so this is what our website looks like, and it was on one of those PowerPoint slides. And so you can come in here and you'll find all the information. So the eligibility that I spoke to, and then here the how to apply. And so when you go to the how to apply, here is our pre-admission checklist. And once you hit this, this is the form that you would need to complete. and email to me with non-official transcripts. And so you would email this with non-official transcripts. I would take a look at it, see if you're eligible for our program. If you are, then I would say you're accepted on a conditional basis, and the condition is that you're also accepted into the university. And so that's what you would have to complete and send to me with unofficial transcripts. And basically this is the paperwork that all these prereqs that I had already spoken to you about that you needed in order to come in. And then it also on the second page has a list of courses that are in our program that students could have taken, because sometimes, you know, maybe you decided that instead of taking that combination course at Delta, you're going to transfer in one semester early into Stan State, and you're going to take the Introduction to Health Science course, plus you're going to complete some of these other courses. And so that's why I put some of those there. But most of these courses are courses that you have to be here at the university for. The only two that you can take before entering the university is the Intro to Computer Information Systems that I spoke to you about, and the Principle of Microeconomics. So this is that pre-admission form that you would send. And then I did speak to you that, you know, we say usually take one or the other, not both when it comes to this. And if you want to know how much the program costs and the type of financial aid, that's, here all for you also. And then if you want to know what type of courses are actually in the program, you can go to our course schedule, and here is all the courses that are listed. The cohorts by alphabet, just so you know, these are the ones that are on the Turlock campus, and the ones that are by number are the ones that are on the Stockton campus. So you can kind of see the courses that you would be taking and around the time period that you would be taking these courses. So that way you can see, what type of courses you have there. And that is it for me. Thank you.
All right, awesome. Thank you for that valuable information, Dr. Perea. We really appreciate it. I know a lot of our students are interested in the RN program in the medical field, and certainly the health science degree. So we appreciate you. And I will be sharing Dr. Perea Ryan's information in the chat as well if you have further further questions. And I do appreciate and thank all of the students are engaging and asking your questions. We will address them at the end of this presentation. And next, we have, last but not least, we have our last presenter, which is Mr. Josiah Jaramillo, who will be presenting on the workforce development resources and internship opportunities here at Delta College.
Sorry, everybody. Let me get everything set up. And I want to make sure that I want to give all those excellent questions and all this, my mind's exploding with all this great information. And I'm a firm believer, you begin with the end in mind. So hopefully you all are having a great summer so far and getting a lot of information that's going to be useful. And in tandem, using this information and keeping that motivation going. So a little bit about myself. I'm the workforce specialist here at the CTE and Workforce Development Center. And, my job and my role as a whole, as far as our department, is to help make sure that we emphasize that training. So that training aspect is helping people get qualified for those high pay, in-demand jobs through our CTE programs. A little bit about what CTE, Career Technical Education, also known as vocational training or career education. And we're really trying to help bridge and connect the actual curriculum component, hands-on component with the practical piece as well. And so, the last point here about the meeting of the needs and having the training for our community, it's an understatement, especially coming off the pandemic. And with my experience helping our track and helping our pathways, the need is great. And so I'm the workforce specialist assigned to health and fitness. And so some of the programs that I also, well, excuse me, some of the tracks that I also support is our technical career trades, and then also business and law. So if you do have any friends or family that are interested in support, I too could help them. But back to what we support here as far as kinesiology, fitness specialists, psych tech, rad tech, our certified nursing assistant program, which is back on track, and registered nurse, as well as SLPAs. For our CT and Workforce Development Center, I affectionately call us the room that's directly across. I don't know if you all have been to the new In-N-Out Burger on Pacific Avenue, but it's very hard to keep a good diet being across the way from there. But literally, if you walk straight across the street, that's where we're located in Dorico, 149. And I included our hours that are typically fall, spring semester for Monday through Friday, 8 to 5 for in-person. But right now, currently, our summer hours are Monday through Thursday, 8 to 5 for in-person. And then Friday, 8 to 12 p.m. I also included in my contact information. I think we're going to have that at the end of the presentation too, for any questions that you might have, and maybe some work related to your professional development that you have in mind. So a little bit about what we do as a valuable resource to kind of help and connect some of the presentation information that I saw before. A lot of times there was questions I think I saw in the chat about, well, after I graduate, what salary look like, and you know, what can I be expected to do? Well, there's going to be a difference, right? There's going to be a difference between how much experience that you have as well as your academics. And so part of our workforce preparation in that professional development process, it's an ongoing thing. So either myself, my counterpart, Beth Waters, Susan Vang, we will hold boot camps, and it could be specifically for resumes, it could be specifically for cover letters, but we do that throughout the whole semester. Part of the pandemic and what it's really taught us is that typically we would try to do in person once upon a time, and now just like today, we're flourishing, and a lot of people are getting help. A lot of our students are getting help with one-on-one using virtual. So we do a little bit of both, and we are excited that the fall semester we're finally going to be able to see your smiles, your enthusiasm, and we look forward to that. Work-based learning, so we do help with the placements. So the idea is that there's a variety of opportunities out there. So right now we do have like the 1,000 internship initiative where Delta College, I'll give the brief summary. Delta College pays up to 12 weeks from an employer related to the health field, anywhere between 10 and 20 hours in the work week. So we still want the students to balance out, you know, the academics as well as get that work experience. But again, if we place a student, I'll just use someone who I spoke with today, community medical center, and it could be entry level, could be at the office setting. That is a valuable work experience where the Delta College pays the students, and we're supporting the employer out in the community to fill the needs. And so this is a cool opportunity to actually get the hands-on learning as well as maybe some of the theory, because some of you are all different stages in your academic journeys, to bridge those things. And so potentially to answer one of those questions, what's my salary look like? Well, it might look a little bit better with some of that work experience, along with perhaps, you know, for some of you that are looking for RN experience, I think I saw LVN as a pathway to go ahead and get your bachelor's as well for Stan State. So there's a variety of pathways that you all will be able to seek out and still be able to get the internship experience and bridging and connecting those two things together. The eligibility is literally 2.0 or above, literally the same thing as far as entry level or entrance, for Stan State transition or transfer. Also 18 years of age and older. And the only limitation is that the last day attended has to be within that calendar year. So for instance, someone that attended spring of 2021 would not be eligible for that internship. However, if you did summer school last year, even though it's close, you're cutting it close, we would still be able to help and provide the assistance. So typically, volunteer work, work-based learning is really the way to help expand your experience, put together practical use for your education. And that's something that we're really excited about. These are just some of our employers that we're working with. So maybe some of you are like, well, I don't really have any work experience, Josiah, or some of the things that I'm doing is working at Amazon warehouse. Like, that's not significant. And I would challenge you and say, actually, it is. So part of our experience that we'll have together is extracting things, whether it's volunteer or your hands-on experience working at Amazon, is something that you might feel that's not related to maybe the health or fitness industry. My part of our preparation is saying, no, there really is. If someone's bilingual, it's like, hey, you're translating, or if someone is a leader, even working in a warehouse, I'm just using that as an example, or a fast food restaurant, which are typically entry-level jobs. There is pathways and there is soft skills that our employers are begging for our students to come out and show. So part of our thing is to say, hey, and talking to the employers that you see here, whether it's Dignity Health, Community Medical Center, of course, Department of Corrections, that we have active and urgent students with a sense of urgency that are enthusiastic about continuing not only their endeavors with them, but then continuing with some of the things that we saw today that in the presentation that preceded this one. So what my goal is to increase our participation with our Delta College students using Job Speaker. So I think you'll probably see this in the chat. I put a flyer out here, and it's a digital flyer. So I highly recommend and encourage you all to use this real simple, straightforward flyer. So if you can, download this information. It's something that we came up with because our active students are only talking to some of the employers that I showed in the previous slide. The best way to bridge that gap is using me as like the middle person to connect these employers that need fantastic, talented students like yourself to get out there and take some of these jobs in our community. Typically, I'm sure you're familiar with like Indeed, Career Builder, things of that nature. This platform is specifically for Delta College students. Right now, if a job is coming in, even though it might be entry level, again, just referring back to the previous presentation I saw, I think behavioral tech, administrative assistant, these are the types of jobs that are coming in. What I typically do is click health science related jobs, and whoever has that account, you automatically get a notification because you have a profile set up. The profile has an embedded resume that is in there. So you and I can work together to actually make that Amazon fast food volunteer experience shine. So then that way someone can go ahead and choose you. And that someone is an employer, typically an office manager, someone in the medical field or related fitness field as well. So this is a very important slide to me because we need more people like you to participate, people with a sense of urgency. So then that way we increase opportunities to help you get placed and then sometimes get points for some of these programs that you have aspirations to enroll in the future. And so Job Speaker, this is just a quick little overview of how it works at Job Board. You just enter in, I'm an administrative assistant for a medical center, and I'm generalizing here, but it's for SJDC, as you can see, jobspeaker.com. So it's specifically and only for our school, but there's opportunities throughout all of California, in some cases nationally too. So part of our experiences is, okay, thank you, Josiah, for the resources, but you know, things things might cost money for uniforms, equipment. Right now, I don't have the funds to be able to do that. Well, we also work with WorkNet. Literally here at the Dorico 149, we share a space in the Workforce Development Center with WorkNet. So they assist and help with opportunities to get training, employment, supportive services. Kia Yang is the person that helps out and supports individual students. Yes, we just opened up several weeks ago, so you are able to walk in. But typically what we could do is set up appointments. And again, they're helping with different types of training for certificate programs. They offer additional workshops, additional money and eligibility for any type of like uniforms and equipment needs. And it's a little bit different like financial aid, where typically they're asking for family income. It's on individual based income. So there is a lot of funding available, even though you may not have qualified for federal financial aid due to maybe parents' income as an example. The other thing that we offer is veteran resources. And so priority services such as like the referrals, training. Viper List is a priority registration where when there's these events that happen or job postings that happen out in the community, our veterans get priority to take a look at those jobs and apply as well. So right now we're kind of in the process or transition of summer schedule. So we have Mondays, Tuesdays, and Thursdays, 8 to 4:30, as you can see. There's meetings every Wednesday. So right now it's only from 8 to 2:30. And then of course, Friday, 8 to 11. When we resume again with the fall, it'll be operational in-person hours from 8 to 4:30. And again, Kia Yang is the representative that helps and supports our health and fitness. So I can't see the chat, so I apologize, but I put my contact information, so go ahead and download it. If you notice that there's a person there with like a lip curtain mustache, it's like I'm like those animals that you see in YouTube. I shed in the summer, and when I took that picture, it was cold, so that's my excuse. But I look forward to working with you, and I just got to give a shout out to everyone who showed up today, because you are the go-getters that we need in the community to help move us forward. So thank you.
Thank you, Josiah. I really appreciate you sharing this information with all of our students here today. I know that the students in the health and fitness track are definitely go-getters, so I agree with you. So now is the time to connect and your opportunity to ask questions to our presenters. So with that said, go ahead and raise your hand or enter your questions in the chat, and we'll go ahead and answer those questions for you now.
And we do have a couple of questions in the chat, Macaria, so
perfect. So for Josiah, since you were the last presenter, I know we had a question here regarding psych tech. Is there internship opportunities for students in the psych tech or interested in psych tech?
So yes, and I'm still working, because sometimes we have to get side agreements, and the other thing is to work with our faculty. So we have a lot of faculty, a lot of people that have connections. My role started in October of fall, so please, what I would encourage you all to do, if you have a question, create the Job Speaker account and just keep on connecting with me as I start creating the opportunities, because I have to talk to the employers to create those job descriptions posted. And then I keep a good long list of our specific programs and students that I support to help you out and funnel those jobs your way. It's a great question.
And I also wanted to share that, doing internships is a great way to try on. If you're thinking that you're interested in a certain health career, but you're not sure, before you spend tons of time in education, right? And then realize, I always say, the thing that probably breaks my heart the most is when somebody has done all the work to get into the nursing program, and then they stop out within the first few weeks because they realize this isn't for me after they did all that work. So anytime you can get any exposure to any health career that you're interested in, please take it. We also in our program do have a practicum experience, because we believe that hands-on at the end as a culminating experience is also important.
Awesome, thank you for that. Cher, do you want to unmute yourself and ask your question? Cher, we can't really hear you.
Can you hear me now?
Can you speak a little louder?
Sorry. Can you hear me?
Much better, thank you.
Okay. So I have this question.
We can't hear you again, Cher. if you don't mind, if you could type your question in the chat box, please, just because we're having a hard time hearing you.
Okay.
Please, thank you.
While she's chatting, while she's typing that, there are some questions that were asked in the chat earlier that we can kind of go through. I don't know if we saw them.
Yes, let me see here.
Let's answer that one that you just put in there, Joy. I work in pathology in a local hospital. How much help would this be with majoring in health science to eventually be a pathology aide? Can someone answer that question?
So as far as what you'd have to do is go to which, what are the requirements for a pathology aide and see if getting your degree is going to help you with that, right? I mean, because there's so many different health careers that you get into that I can't, I'm not sure with all of them, but go into what you need for the requirements of that and then look at our degree and see if they fulfill that. Or at least come close so you don't have to do as many things and you're able to get your degree as much as possible. That's what I usually tell students. Like once you figure out where you want to be, what your goal is, you first go to those school websites, like what you need to get in there, and then kind of work backwards, like what degrees will help you get there or to the closest possible so that you aren't having to take a bunch of classes, spend a bunch of money that you don't need to in order to get your degree and end up where you want to be for your goal.
Thank you for answering. We do have another question. Do we have to travel to the school or can we do it online?
So the program is hybrid with some in person. And so you would have to go to the Stockton campus or to the Turlock campus. We are at this point in time working on a fully online program, but that probably won't start until fall 2023. So we'll have both the hybrid in Stockton, and then instead of actually having a Turlock campus one, we'll have a fully online program. So that is going through the work. So I can't say until it is approved. Right now we have a hybrid program.
Thank you. Thank you. What classes count from Delta College for the critical thinking section?
So I'm going to put in here in the chat a grid that you can go to within the School of Nursing that has a lot of the equivalencies that you can look at that would be equivalent for those courses, because I saw that also for chemistry. So on this same form, that on the same link, you can go to and look at what the equivalents are from Delta that we would accept.
Okay. Is there financial aid for the ADM program at Delta?
So that depends. It depends on the units that students have completed. All schools attempted and cannot have a bachelor's or master's degree, and also they cannot exceed the number of units for the program.
Thank you.
And we also encourage students to contact their financial aid specialist for further information.
Sounds good. Thank you. When should we plan to meet with Dr. Pereira Ryan regarding the pre-admissions checklist if we plan to apply for spring 2023?
So that would be the August through October. So I always say, like I said, it is on a first come, first served basis. So please reach out to me earlier in August than towards the October 1st date, because then if we're full, I have to say, sorry, Charlie.
Sounds good. Thank you. Thank you.
We have a few more questions if the presenters are okay with that. We just have a few more. Cher, I have an associate's degree already spring 2021. What do I need to do to qualify for an internship in healthcare or healthcare administration?
Having an account is gonna help you out, associate's degree or not. Any degrees that you have will be beneficial for you. So create that job speaker account. I messed up. The file upload is really for only PNGs, which is more like pictures. And so hopefully we could get the information that I sent to our hosts out to you all. So then that way you could create that account.
Send it to everyone.
I put my email in there too, so I could help out anybody who's interested. So I'd say very likely to get an internship opportunity. And something else that I missed, part of the tasks and the things that I like to do, think of it as a mini interview. So if we're setting up an appointment, I'm the person talking to employers. Allow me to say great things about you by making sure you're punctual and be ready to go by the test that I give you. So one thing that I missed out.
Thank
Awesome.
you.
Thank you, Josiah. Fro, do you want to go ahead and unmute yourself?
Yes, thank you for that. So I have a question from Dr. Director of the Stanislaus State. I got all prerequisite for the RN, which I can use it for the MGC or Delta, but I want to do it at the Stanislaus State. Like the counselors told me that you need to English 103 and statistic if you want to apply in the Stanislaus State. So, and I have a degree from outside of the country, a bachelor degree. So does it help me to apply or to be registered for the RN program?
No, so already having a degree beforehand doesn't help you with the nursing program. So that's a good part. I can answer both health science and nursing program questions. So having a previous degree doesn't necessarily, you can check to see if it might make you available to apply to the ASBSN program. So the accelerated second bachelor's degree program that we have on the Stockton campus. So you could look into that if you have a bachelor's degree. Again, they would have to check equivalency and all those types of things. And that is out of my forte. So, you know, definitely something to maybe talk to, I don't know, Joy, if they would send you to, or you can talk to Surveying, who is the administrator for our accelerated second degree bachelor's of nursing, and he might be able to give you more information about that also.
But I don't, sorry, but I don't have the degree of nursing and the back of them. Like I have the other about the health science, like a medical.
Yeah, no, the accelerated second degree bachelor's is actually a pre-licensure program. So you actually don't want a degree in nursing to go into that program.
Okay. But I had completed all prerequisites for the RN program. So can I apply for a Stanislaus State? But I am, I should take the 103 or statistic also, or?
Well, you need stats. I mean, it is a prereq. You do have, that's one of the prereqs. And then the critical thinking, which I think is the English 103 that you're speaking to, also is a prereq. So if you haven't taken those, then you would need those.
If I'm in the middle of that, can I apply for that? I mean, like
Yes.
I took.
You can apply with courses in progress as long as they'll be completed before your first start date. And that's true with the health science program too. So if you don't have all the prereqs completed when you apply, as long as they'll be completed by your start date, you can do that also.
Thank you.
Thank you, Fro. And we'll just go ahead and ask one more question and we'll wrap up this information session. I'll put my information in the chat. If anyone has further questions or they feel like their questions weren't answered, feel free to reach out to me and I'll make sure I get that question answered for you. Thank you.
Last question is, can you please just piggyback on the, why should you take computer science and macro together?
Well, not. So we said you should not take both, one or the other. And the main reason is because you have to have 50 units at the university in order to get a bachelor's degree. That's a university requirement. And so if the program itself is only 54. So if you take both of those, it takes you down to 48 units. And now you don't meet that 50 unit minimum requirement. So that's why we recommend one or the other.
All right.
Sounds good.
Thank you, everyone. Well, this concludes our presentation. Thank you so much to our presenters, Dr. Berea Ryan, Josiah, and Ms. Joy Vickers. Thank you all for joining us. We appreciate you all. We hope you have a great night. Thank you.
And this is a recording session, so we will have this recording available. Makaria, are you going to be posting this anytime?
It will be posted and it will be emailed to all who registered for this information session. Thank you for that, Marisol.
Yes, thank you. And for all those questions that were not answered, please email them to Makaria Mesa. She will be gladly to answer the questions for you. And if we don't know the answers, we'll get the right person to answer them for you, okay? Thank you.
Thank you all. Have a good night.
Take care. Good luck,
evening.
everybody.
Thank you.
Thank you.
Thank you. Good night, everybody. Thank you.